The second topic that we need to cover in our Equine Health Clinic is biosecurity. So many of our clients could probably do with some enhanced biosecurity measures on their yards, and as we all know, the movement of horses between yards is responsible for a high proportion of cases of infectious respiratory disease in horses. So you could use the health clinic as an opportunity to talk about putting some isolation measures in place and a quarantine period, and also not just for incoming horses, but obviously we also need to isolate horses which are showing signs of disease. So we could discuss measures like isolating the first horse that has a nasal discharge or a cough, and doing barrier nursing and temperature checks, and actually helping to stop the spread of the outbreak at the beginning. One of the main factors often in reluctance to isolate moving horses on busy competition and livery yards is the frequency of horse movements. So in these situations, perhaps there are other measures that we could discuss which might also help reduce the incidence of infectious disease, such as keeping those horses which are moving frequently to competitions in one yard group and not having them in contact with vulnerable young stock or aged horses. Also keeping consistent turnout and stabling groups and not mixing and matching, and advising owners to minimise contact with other horses when they are at competitions can all help reduce the disease spread within the premises. Other biosecurity measures which could quite easily be put into place on client premises include disinfecting stables between horses. Even disinfecting foaling boxes pre-foaling often doesn't happen and is important. Hand washing, obviously we're all used to doing that for our own COVID protocols and hygiene between horses, but sometimes on the yard when you're busy it doesn't happen. Also, a lot of the other principles that you might use in your own practice, you could transfer to a client's situation equally.